Moka Lantum. I'm the CEO of Sagittarius Limited, access to healthcare for blue-collar workers. When we're talking about blue-collar workers, right, we're talking in many cases about the women in the workplace. Now, insurance companies and most employers do not cover for reproductive healthcare services. Family planning is not part of the employer's agenda. Sexual and reproductive health needs is not part of the conversation in the workplace. Whereas those are needs which I would say most women in the workplace have month to month. And so there is a huge opportunity to innovate and to really help corporations say what can we do to really meet the needs of the healthcare worker. Now, more importantly, is that when a female employee particularly struggles to pay for healthcare benefits, which is real, if her baby is sick or her mother, her father is sick, she usually picks up the bill. That's the hustling professional, right? What we found is that they then now have to look for secondary sources of income. In that equation, many things happen. And unfortunately, in some cases, it ends up people becoming sex workers in order to make get the extra dollar either from a friend, from a partner, or from actual, in a transactional way. And so we're seeing that it's a really fertile ecosystem for health innovation. And we are fortunate to be able to work on that problem with a lot of companies that find the opportunity to say, we can make it a little bit better for employees by working with Checkups Medical, which is a healthcare service arm, to make it a little better for families. And that's really what excites me. In the Ashoka philosophy, change is a very simple concept. It's about what is the purpose of what you're doing, right? That's really the most important thing. And the notion comes from the fact that if you're in a process or in a system and you change the parts or the players, so if we're playing a soccer game and you change the players, you have not changed the system. The objective and the purpose is still that the person who scores one goal more than the other person wins. And the best player is the one who makes all the money. So it still creates a lot of social inequalities. But then you could change the rules of the game and say, rather than kick the ball, let us play the ball with the hands. It goes from basketball, but it is still designed to make sure that the best player gets the most money and the team that wins is the one that is recognized in the league. But if we change the purpose of any sport and say, for every goal you score, a child somewhere would get a scholarship and go to school, then it becomes real change. And so we look for opportunities to change the narrative and say, what does it mean to your company to make that employee have access to healthcare? What does it mean for you, right? What is the purpose of giving your employee healthcare? And in those conversations, now people start saying, oh, it can help me acquire a new customer. It can help me retain. It can help me save on other things that I was not aware of. For example, if I am short on cash, I could be very tempted to use company property inappropriately. So the repercussions of having affordable healthcare is not just about the individual. It trickles down into how the person relates to your customer, the risks they bring to the workplace, and even how they use company assets. And those are all things that we now should be thinking about in terms of why do we have to provide healthcare to our employees?